Morning, everybody. We will get started in about 10 minutes. If you've joined us already, thanks for joining, and we'll get started shortly. Thank you. Good morning, everyone. Thank you for tuning into today's webinar on using 211 to connect to substance use disorder resources. This is the third webinar in our summer webinar series, and we are thrilled to have you join us today. My name is Alana Krober, and I am the Director of Information Services here at United Way of Connecticut 211. And I'm here today with my colleague, Kim Jackson, who will be helping me with the question and answer if there's time at the end. Kim is a manager in the 211 call center with a specific focus on our efforts to support connection to treatment and recovery. A few housekeeping notes before we get started. Participants' audio is muted today. However, you can use the Q&A box in your webinar controls to chat in questions, and we're hoping to have a few minutes at the end of the webinar to answer them. However, even if we run out of time, as long as you've submitted your question in that Q&A box, we will provide written answers to all questions that are submitted in our follow-up email, because we will send a copy of the PowerPoint and a link to the webinar recording in the next day or so, and we will include written answers to any questions that are submitted in that Q&A box. Okay, so let's get started. Here's what we will be covering over the next 20 minutes or so. This webinar will be intentionally short, as we know you're all busy, and it's really designed to give an overview of the resources 211 has to help individuals who are struggling with a substance use disorder. So our objective today is to make sure that people know how to connect to help when it's needed. So today's session is not intended to provide a thorough overview of 211 services, nor is it intended to be a comprehensive tutorial on how to use the website. If you need that background or want that background, the recording from the first webinar of this series is posted on our professionals page, and here's the link to that page. And that's a great overview of 211 and a great tutorial of how to use all of the features on our website. Okay, so I want to spend a minute reviewing the various ways that providers and clients can connect with 211 today. We understand that help seekers have many different preferences, and we're working hard to continue to expand the number of channels that folks can use to connect with us. So the traditional way that Connecticut residents have connected with us over our 42-year history is by phone. So by simply dialing the toll-free, easy-to-remember 3-digit dialing code, individuals can reach a 211 contact specialist 24 hours a day, 7 days a week, 365 days a year. And calls into 211 are anonymous and private, and it doesn't have to be the individual in need who calls. In fact, more often than not, it's a friend or a family member or a provider who is calling, trying to gather some information and referrals for someone needing help. 211 contact specialists provide supportive listening on these calls. They do a brief assessment, provide relevant referrals, and offer to follow up with the caller in a week or so. And you can see over on the right here that this past fiscal year 2018, there were over 6,100 requests called into the 211 call center that our contact specialists handled from individuals that needed substance use disorder resources. Individuals can now also choose to chat with a 211 call specialist if they prefer that over calling. And we know this is often the preferred method of communication for younger individuals. And as you can see on the right, 20% of the requests for help with a substance use disorder this past fiscal year were for individuals aged 29 and younger. So this is a significant portion of the population that's seeking help from us, and an increasing number of folks that are choosing to connect with us via that chat channel. And lastly, individuals can opt for the self-service approach and search our website themselves for programs. So there were over 9,700 searches for substance use disorder resources on 211ct.org last fiscal year. And that number will most likely continue to increase as we see a general increase in website traffic year over year the past 4 to 5 years. So our call volume related to substance use disorder resources continues to slowly decrease, while the web traffic related to this topic continues to increase. And although every call to 211 is anonymous and private, it seems that for many folks, using the website feels potentially like a safer first step, as it's, they don't have to interact with someone and they can go on in their own time and search for help in their own way. And then also at the bottom, you'll see we'll be adding some additional ways to connect with us in the future. So one way will be texting. So we'll be adding an option for individuals to text in and speak with a 211 contact specialist via text for information and referrals. And we're also working on getting our 211 search engine integrated with some of the voice-activated assistants like Alexa, so that individuals who may not have a smartphone or a computer or are unable to use those devices can speak into one of the voice-activated assistants for information and referral. Okay, so given how many people are using the website to search for information and resources, I'm going to spend most of the rest of the time reviewing the different tools and features of the website that can help. The 211 database of community resources that our call specialists use to search for programs for callers is also available for the public to search on our website. The database contains over 40,000 community resources, including substance use disorder programs, and is maintained by our team of 6 resource specialists who are updating and changing the database every day, all day. We have resources listed in the database that address each intervention point or stage related to substance use treatment and recovery in the database. And one way to search for resources is the keyword search on our website. And so you'll see this screenshot here at the top is a screenshot of that keyword search. It's prominently located on the home page, and it's where you can type in the name of a service you're looking for or the name of an agency or program, as well as a location. You can then hit search and then quickly and easily filter your search results based on radius, age, gender, target population, or day of the week that a program is open. So the keyword search is great for individuals who know what they are looking for, but that isn't always the case. So many of our callers may know that they or a friend or family member needs treatment, but they don't know where to begin. Figuring out what kind of treatment options are available can be really difficult. It's a maze of clinical words and terms that most people aren't familiar with. And so for those individuals, we recommend using option 2 or 3 that's listed on this slide. So option 2 is our help statement, and it's located in the middle of our homepage. There are about 15 common language help statements. The one that's applicable to this topic today is I need treatment for a drug or alcohol addiction. You hit continue, you put in your location, and it's an easy way to start your search. You don't have to know a specific term, you don't have to know a specific treatment option. You simply select that help statement that reflects your particular need, and you'll get an initial list of results back. The third way, which is really a great place to start if you're not sure what type of resources or help you need, is our substance use disorder category page. And you'll see down at this last screenshot, we have categories related to food, mental health, healthcare, housing, and all the way on the right there, substance use. And we're going to take a look together at that page when we do the live demonstration of the website in a minute. Another good place to start is our e-library, or our electronic library. We have approximately 400 white papers in our e-library that provide brief overviews of topics and programs. You can see in the screenshot here that you can search the e-library by keyword or by category. And if you'll take a look at the right-hand column, you'll see there's an entire category of papers related to substance use disorder. So by clicking on that category, you can browse all of the eLibrary papers we have related to this topic. And of course, lastly, we recommend that you sign up for a free My211 account to help pull together and save all of the resources that you find on the website. So as you are searching the website using the category page, by using the keyword search, as you begin to find helpful programs, having a My211 account allows you to start to put those programs together into customized resource lists, either that are topic specific or specific to an individual friend, family member, or client. You can then save those lists, share them, and update them as needed. Okay, so on this next slide, there are going to be a lot of words, which we try not to typically do when we give presentations, but I really wanted to give you a fairly comprehensive snapshot of the types of substance use disorder services we have listed in the 211 database. So you'll see a bunch of buckets that I'm about to put up on the slide. And in each bucket will be the primary services that we have listed in the database. And along with the count in parentheses of how many programs we have listed for that service type. So in this first bucket of assessment and intake, the two primary services that we have listed in the database are general assessment for substance use disorder and central intake and assessment for substance use disorder. And you can see for that first service type, there are 159 programs in the 211 database that provide general assessment for substance use disorder. And that's a great place, and that's a great term to know because that's so often where people need to start when they're not sure what the appropriate treatment plan is or the appropriate level of care. Having that general assessment done is really critical. And so, you know, we really want folks to know that term and how to find those programs. And then the next bucket is treatment, and you'll see the primary services we have in the database under the treatment bucket. So everything from detox programs to residential, to day treatment, to medication-assisted treatment, smoking cessation, and then our recovery and support services. So these are the programs that provide additional support to individuals and family members that are going through recovery. And so the top there, we have supportive substance use disorder services. This is a relatively new category of program that we've put into the database, and these are the recovery coaches. So again, a relatively new service being offered by hospitals and some other organizations. So to find those recovery coach programs, that's the term to use. Also in this bucket, we have our substance use counseling services, drop-in services. We have some residential services for recovery, like sober living homes and the halfway houses. And we have support groups, right? Such a key piece to recovery. So we have support groups for the individual themselves, both for alcohol and drug use. And then we have support groups listed for the friends and the family members of individuals struggling with a substance use disorder. We also have programs listed for intervention programs. And then this bucket are some of the programs related to education, prevention, and harm reduction. So we have a number of programs listed that provide education and prevention information. We have medication disposal sites. So these are all of the safe drop boxes that are located in communities where folks can safely dispose of their medications. We've recently added the opioid antidote distribution programs. And so what that is, it's a kind of a long, complicated term, but it's really the locations where you can go get Narcan. And so this is really important that people be able to access those locations and those sites quickly and easily so that they have ready access to Narcan, which can reverse an overdose and save a life. And then also needle exchange programs. And of course, we have listed in the database programs for, so many other needs that folks might have, but related to substance use disorder, specifically medical appointments transportation is particularly relevant, as well as insurance options like Medicaid. So these are the exact terms that we use to categorize services in the database. And so searching these terms will yield the best results, but you don't have to use these terms. You can search whatever term or short phrase you choose, as the search engine is designed to accommodate for common language searching. So for example, you don't necessarily need to search medication-assisted maintenance treatment for opioid use disorders, although you can, since you now know what the term is. You could search heroin treatment and still get that same list of results back. You don't have to search inpatient drug detoxification. If you searched detox on the website, you would get the list of all the detoxification programs back. You don't have to search opioid antidote distribution programs. If you searched Narcan, you would get that same list of results back. So we want you to sort of know what the actual terms are that we use to categorize the programs and how to most efficiently and effectively search for them. But please know that when folks come to our website, they can use common language search terms and phrases and still get a good list of search results back. Also, before we move on to the live demo, something else that's really important to us is that the 211 resource database always be a dynamic, living thing that changes and evolves to meet community needs, which is why the database has changed a lot over the past few years. We have retired resources that were no longer relevant in order to make room for a bunch of new resources. Let me just go back a slide. A bunch of new resources like the medication drop boxes, like the locations to get Narcan. These are all resources that we didn't have in the database 5 years ago. And so, in order to meet relevant community needs, we continue to remove things and add things. And so as you use 211 to find resources, please don't hesitate to reach out to us about things we might still be missing. Getting feedback from users is how we can continue to improve the database and the website. Okay, so let's go to the website now and take a quick look at some of the tools and do a sample search. Okay, so again, the website is 211ct.org. And up at the top, you'll see that chat feature that I talked about a moment ago. You'll see my 211 account. I have a free account and I'm logged into it. And you'll see the globe icon, which allows you to translate the website. So just 3 important things I wanted to point out quickly. You'll also see the keyword search that we talked about. In the middle here, you'll see those help statements where you can select the I need treatment for a drug or alcohol addiction. And then a little bit further down here, you'll see all of those categories that we took a look at. So I'm going to go ahead and I'm going to click on the substance use icon to take me to the substance use category page. And this page has been recently revamped so that it's more user-friendly to allow folks who are, who may be in those beginning stages of trying to figure out what kind of help they need and what some of their first steps and action items can be, making it easier for them. Well, so that page doesn't want to load for some reason. We'll just try it one more time. Okay, well, since that page is not loading at the moment, we'll go ahead and we'll just do a sample search from our keyword search so you can get a sense for how that works. So if I wanted to look for day treatment options, for example, I might start to type in substance, and I am presented with a list of suggested terms as I begin to type. And like I said before, you can select one of these terms, but you don't have to. You could type in your own term as well. I'm going to go ahead and look for my day treatment. And then you want to enter a location. So you can put in a zip code, you can put in a town, a county, or a specific street address. So if I'm working with a client, I want to put in their actual street address because I want to find resources that are closest to them. So let's say that my client lives at 100 Cedar Street in New Haven. I can go ahead and click search. And I get a list of 17 day treatment programs that serve someone living at 100 Cedar Street in New Haven. And I can browse this list of programs using the list on the left, or I can use the map and take a look at them by using the pins on the map. So I can zoom in to look at the area I'm interested in, and I can click on the pins to get a sense for what programs are available. If I find a program that looks like it might be helpful, I can click on more details to see the full record. So this record, for example, I'm seeing the program name, the agency name, I'm getting a description of the program, eligibility information. If I scroll down a little, I'm going to get the address and phone numbers, hours, the website, information about fees, the area that the program serves, languages offered, and then a little bit further down, information about the parent agency. If I want to filter my list of results, maybe 17 is a lot to look through, I can use my quick filters. I could filter based on target population. So if I knew I needed a program for someone with dual diagnosis, opioid use disorder, a youth, or a pregnant woman, these are handy and quick filters to find the programs that are applicable to these populations. I could filter based on radius. If I'm working with a client who has limited means of transportation, I might want to find a day treatment program within 5 miles of where he or she lives. I could filter and find a program that's open right now. I could filter based on day of the week. If I'm working with a client who needs a program Monday and Wednesday because that's their availability, I could do that. I can filter based on gender, which is not particularly relevant for day treatment programs, but it certainly can be for residential programs. I can filter based on age group. So maybe I'm working with a 19-year-old and I want to filter based on the 17 to 24-year-old age group. And then I'm going to hit filter. And so now I have 9 resources and instead of 17 to take a look at. I can see where they are on the map. And maybe I want to start to add them to a list for a client that I'm working with. So I could add this one that we looked at to a customized resource list. I could create a new list right now if I needed to by just typing in the name of a list, or I can select it from my existing resource list. And I already created one for our demo client today. So I'm just going to add that to the list. And then you can continue to add additional resources to the list. So as you go down the list and you find more options that might be relevant, you can continue to add them. Right, so maybe I want to add this one to the list as well. And that one gets added to the list. Now, the client that you're working with may have additional needs, so you could go ahead and search for additional resources as well. So, maybe we're working with a mom or a dad who's trying to help their young adult child, and maybe they need a support group, right? So we could start to search for support groups. And we can see the list of support groups that we have here, right? So maybe we want to look for a support group, the families, friends of individuals. We could search for that, right? And we could go ahead and add these to our list as well. If they're going to need transportation, we could do another search for transportation. See if there are any transportation resources available to somebody that lives at this address. Take a look at the details, right? Make sure that it's going to work for this person and then add it to their sort of personalized action plan. And then if we want to take a look at that list that we've created for the client we're working with, we can come up here to My 2-in-1 Account. We can go to Resource Lists. And then we'll see here, Demo Client New Haven Treatment Resources. We can open up the list to see all the programs that we put in it, or we can go ahead and share this list. If we click on share, you'll see that we can email this list to our client. If it was a topic-specific list and we wanted to share it with colleagues, we could email it to colleagues. We can put in a note. We can put in our contact information if we're sending it to a client. Alternatively, we could text the list to ourselves or a client, or we can grab a shareable link. So if you click copy link, we've grabbed a shareable URL that we can embed in an email, on our own website, or in a newsletter. So a lot of great ways that we can share the custom resource list that we've put together. Okay, so that's a little bit on how to use the 2-in-1 website to find some of the resources we've talked about. I'm just going to try clicking on our substance use category page one more time, see if it'll cooperate. And if not, I encourage you all to take a look at it on your own. It will most likely cooperate for you, even though it's not cooperating for me at the moment. So I'm just going to go ahead and come back to our PowerPoint. I know we are almost at time, and we want to be respectful of everybody's time. So very quickly, just a couple of other go-to resources. All of the resources listed on this slide are listed in the 2-in-1 database, but we wanted to highlight these as these are some of the most utilized resources. So the free online screenings that are available at Healthy Lives CT for alcohol use, drug use, depression, anxiety, and more. Great online tool for somebody to take on their own. The Department of Mental Health and Addiction Services access line. DEMAS also has a website that has bed availability for DEMAS operated and DEMAS funded treatment programs. So that's a great way to start to get bed availability on any given day for some of those programs. The Connecticut Behavioral Health Partnership. This is just for Husky members, but anybody on Husky who needs to find providers, they're a great resource. And then, of course, the Connecticut Community for Addiction Recovery, or CCAR, provides great trainings, resources, telephone recovery support, and more. Okay, so I'm going to try and quickly wrap up now with a few simple takeaways or action items. We've talked a lot about, using 2-in-1 today to find information and resources for individuals, and you can do that again by dialing 2-in-1 24/7. A great place to get started is that substance use disorder category page, and the direct link is there for you. Browsing the 2-in-1 e-library is also another great way to get started, and the link is there for the specific category for substance abuse. Using the keyword search to find assessment centers, treatment facilities, support and recovery services, and other programs. We also encourage you to sign up for 2-in-1's Data Glance monthly newsletter. This provides a snapshot of new programs that are added to the database each month. So it helps you to stay in the loop and up to date on what new programs or service types we've added to the database during the previous month. If you're a provider and you aren't listed in the 2-in-1 database and you want to be, you can complete the electronic intake form at the link provided or contact our resource department. Or if you're an organization that is listed in the 2-in-1 database, we would encourage you to take this time to review your listing and submit any changes or updates to our resource department by using the online form or contacting us directly. And then lastly, I just wanted to spend a minute talking about how 2-in-1 can be helpful in a different way. So we've been talking a lot about how 2-in-1 can connect people to resources, but 2-in-1 can also be helpful in identifying and monitoring community needs and trends. And so that last bullet point about using our data dashboard at ct.2in1counts.org, that is a really great tool for town officials, state officials, community planners, hospitals. You know, if you want to know how many people in your town or your geographic area have called us for help with substance use disorder, you can find that information on this data dashboard. You can see how that compares to other areas of the state. If you want to know what the demographic breakdowns are in terms of you know, the age groups and the gender of who's calling for those resources, you can get all of that information on that data dashboard. So unfortunately, we are at time, so we don't have a lot of time to answer questions, but I would love for folks to go ahead and submit any questions or comments that they have in the Q&A box, the question and answer box. And like I said, be more than happy to provide written responses to all of those questions and get those out when we send out the PowerPoint and the webinar recording. So thank you so much for your time today and for joining us. We have several more webinars that we're offering through August and into the beginning of September. So please go ahead and register for more. And if you have any questions, we'll leave the Q&A box open for another few minutes so that you can go ahead and chat those in. Okay, thank you so much for joining.